Welcome to aminacademy.com. In abnormal psychology, let us discuss about eating disorder, bulimia nervosa. Bulimia nervosa, commonly called bulimia, is a serious, potentially life-threatening eating disorder. People with bulimia binge eat. This means people feel like they have lost control over their eating. They eat large amount of food in one sitting. This often occurs in secret and they often feel very guilty and shameful. Then they try to get rid of the food and extra calories in an unhealthy way, such as vomiting or misusing laxative. This is called purging. If you have bulimia, you probably focus on your weight and body shape even when you are trying to think about other things. You may judge yourself severely and harshly for what you see as flaws in your appearance and personality. Bulimia is related to how you see yourself, not just about food. It can be hard to overcome and can be dangerous. It's important to remember that an eating disorder is not something you choose. Bulimia is a complex illness that affects how your brain works and how you make decisions. But effective treatment can help you feel better about yourself, eat healthier, and reverse serious complications. Bulimia symptoms may include living in fear of gaining weight and trying to lose weight in unhealthy ways, repeatedly eating unusually large amount of food in one sitting, feeling a loss of control during binge eating. You may feel like you can't stop eating or can't control what you eat. Vomiting on purpose or exercising to extreme after binge eating so that you don't gain weight. Using medicines that make you urinate called water pills or diuretics or laxatives or enemas to pass stool when they are not needed. Fasting, limiting calories, or not eating certain foods between binges. Using dietary supplements or herbal products for weight loss. These products can be dangerous. Being very unhappy with your body shape and weight. Letting your body shape and weight guide how you feel about yourself and your worth. Having extreme mood swings. People with bulimia may use different methods to purge. The severity of bulimia depends on the number of times a week that you purge and the problems caused by doing so. Now, let us discuss further about eating disorder, bulimia nervosa. Bulimia nervosa is a eating disorder that causes you to eat large amount of food at one time. That is one sitting. That is binge, and then get rid of it, purge. It can cause serious complications, but recovery is possible. What is bulimia nervosa? Bulimia nervosa, also called bulimia, is a serious type of eating disorder. It's characterized by eating a large amount of food in a short amount of time, binging, followed by getting rid of the food, purging. You may feel like you have no control over what you eat. You might eat large amounts in one sitting, sometimes in secret, leading to guilt or shame. To cope, you may try to compensate by vomiting and laxatives or exercising excessively. These conditions also affects how you see yourself. You may judge your worth based on your appearance and feel like the only thing you can manage is how food leaves your body. This cycle is unhealthy and can lead to serious, even life threatening consequences, but you are not alone. Help is available. Types of bulimia. There are two types of based on ways you may try to clear food from your system to reduce weight gain. Purging. You may make yourself vomit, use laxatives, diuretics, enemas, or other medicines to remove food from your body. Non purging. You may over exercise or fast, not eat in a way that interferes with your daily routine or general health. What are the symptoms and causes? Bulimia nervosa. Symptoms of bulimia may include binging, purging, guilt after eating, facial swelling, fear of gaining weight, excessive exercising, low self esteem. You may also experience mood swing, fainting, constipation, irregular periods, muscle weakness, bloodshot eyes. Bulimia has common signs and symptoms, but it may look and feel different for each person who experiences it. Bulimia nervosa symptoms. Symptoms of bulimia include eating large amount of food in one sitting, that is binging, getting rid of the food you just ate by purging, a fear of gaining weight and a willingness to do whatever it takes to lose weight, a loss of control when it comes to eating, low self-esteem and low self-worth, shame or guilt after eating, depression, anxiety, extreme mood swing, or substance use, fainting, constipation, irregular menstrual periods, muscle weakness, bloodshot eyes, facial swelling, chipmunk cheeks. This condition can look different for each person. For example, you might not eat a large amount of food before purging. Sometimes any amount of food can trigger negative feelings that may make you want to purge. The method for purging may also vary. Bulimia causes. The exact causes of bulimia nervosa is not known, but researchers think it may be a combination of genetics and learned behaviors. Popular culture and the media may put pursue on you to have a central certain body type. These outside influences can affect your body image and self-esteem. Also, feeling stressed, upset, or out of control may all lead to the development of this eating disorder. Some risk factors of bulimia. Bulimia nervosa can affect anyone. You are more at risk of the condition if you are an adolescent or young adult. Biological related to someone diagnosed with an eating disorder, diagnosed with mental health conditions like anxiety or depressions. Complications of bulimia. This eating disorder comes with many health risks. These are dangerous and many can be life threatening. Complications may include abnormal heart rhythm, arrhythmia, damage to your intestine and stomach, dental issues, tooth erosion, translucent teeth or decay, esophagus inflammation, esophagitis and tears, GERD, heart failure, irritable bowel syndrome, increased risk of suicide, malnutrition and dehydration, swollen cheeks, throat and stomach ulcers, type 2 diabetes. Treating bulimia early many prevent complications and any long-term effects that the conditions may cause. Diagnosis and test. How doctors diagnose bulimia? To diagnose these conditions, your healthcare provider will perform a physical examination. They will ask you about your medical history and symptoms. It's okay to be nervous when talking with your provider, but they want to help you get better and won't judge you. So it's important to be honest about your eating habits and behaviors. So, questions. Do you have repeated episodes of binge eating? Doctors will ask, like, do you feel a lack of control over your eating? Do you engage in purging behaviors? Have you experienced binge eating at least once a week for the 3 months? Does your body weight or shape have a strong influence on your self-image? There are not any tests to specifically diagnose this eating disorder. Your health provider may order tests to see how it affects your health. These tests may include blood test, electrocardiogram, kidney function test, urine analysis. Management and treatment. How is bulimia treated? A healthcare provider may recommend the following treatment options. Therapy. Cognitive behavioral therapy is a type of talking therapy. You all meet with a therapist and set goals to adjust how your thoughts affect your behavior. Nutritional counseling. You all work with a registered dietitian or counselors to build a healthier relationship with the foods you eat. Medications. Selective serotonin reuptake inhibitors are a type of antidepressant. They may reduce binge eating and vomiting episodes. They may also treat anxiety and depression. Groups. Support groups can be a helpful addition to other treatments. Connecting with others who share similar experiences may be beneficent to your recovery. So far, we discussed about eating disorder, bulimia nervosa. We have done. Please subscribe our YouTube channel.